Good evening, and this is lecture number 2. Going to talk about the assessment of sports injuries. So I think in the last lecture, in the lecture number 1, I think you all guys are absent. Still, I have recorded the lectures, the first lecture, so you can go to the link and you can download it and you can hear the lecture. And if you find any issues or if you find any problems or any doubt, we can have a discussion on the next lecture. So in the first lecture, in lecture number 1, we have discussed about the introduction of sports injuries, right? So I have discussed about the definition of the basic parts of sports injuries, and what are the different types of sports injuries, the classifications of sports injuries, and the basic management in sports injuries, right? So this is the general introduction, so don't worry. So it is more or less similar to the musculoskeletal injuries. But still, in this lecture, we are going to talk about the assessment of sports injuries, right? So, first of all, we should know the difference about the difference between the musculoskeletal injuries, that is normal musculoskeletal problems, and sports injuries, right? So the assessments in the sports injuries totally different when you compare to the general musculoskeletal injuries. So let me start myself, Dr. Gopal, the associate professor in physical therapy department, right? So I welcome you all. So let me start the lecture. First of all, we should know what is sports injuries, right? A sports injury can be defined as an injury that occurring during sport activities or any exercises, right? So these are the special type of injuries, right? So this may be happen in the normal population, right? So when a player or an athlete is involving or participating in any type of sports activities, right? So either it may be a game or it may be a field activity, field games or track games. There may be a possibility of many type of injuries, right? So these there are sometimes when the person is doing any training, so there may be possibilities of injuries, right? So these injuries are known as sports injuries. So these are the inherent risks involved which leads to injury at one time, another for nearly all participants. So we can expect, right? We can expect such type of injuries in all type of the persons who are involving in any type of sports. So the injuries sustained as a result of participation in sports or in physical activity can be caused by various mechanisms and may be acute or chronic in nature. So the classification of these sports injuries I have explained to you in the lecture number 1. The sports injuries are classified into acute or chronic. So the basic difference, right? So the basic difference between the acute injury and the chronic injury is the acute injury is the sudden onset injuries, right? So whenever the injury occurs, right? So immediately the sudden onset, right? So this is known as acute injuries. Or chronic injuries means it is due to the long-term process, right? So it due to the micro rupture or continuous rupture, right? So for example, you can say the tennis elbow. So the tennis elbow, which occurs due to the continuous rupture of the wrist extensors or inflammation of the lateral epicondyle, so that you can say it is a chronic injuries, right? So this is the broad classification of sports injuries. So just let's go through the first lecture. You might be knowing, you might be getting the details of acute and the chronic injuries. So in this lecture, we will talk in detail about the assessment procedure, right? So what are the important evaluation or assessment procedures that you have to follow in cases of sports injuries. When evaluating any injury or conditions, right, or any sports injuries, the first and foremost, the thing is we have to check the diagnostic signs, and the second thing we have to check the symptoms, right? So these are the two very important things, right? So the diagnostic sign and the symptoms are obtained and interpreted to determine the type and the extent of the injury. So the basic, the principle in sports injury is the first point, right? The first and foremost thing you have to check the diagnostic signs, right? So the diagnostic sign is an objective, measurable physical finding when assessing the patients, right? So what you are getting from the patient, that is known as hears. So in the diagnostic sign, you are asking some questions. So, for example, assume a person is got an injury. For example, ankle sprain, right? So the athlete is experienced with an ankle injury. So you are talking with the patient, right? So you are talking with the athlete, or you're talking with the a person, and you are getting the informations, right? You are collecting the informations. That is here, right? So you are asking many questions to the subject or the participants, and you are collecting many informations, right? So how you fall, when you fall, what is the force, what is the position of your leg, all those things, right? So that is known as hears. And the second thing is feels, right? So second point, that you are palpating that area, right? So you're palpating that area, right? So you're just kind of pressing that area, and you're feeling something right in the injured site. That is known as feels. That is known as palpation, right? So you can say in the medical terminology that you can say it's palpation. And the third one is sees, right? So sees means the smells, right? So sees means you can see what you are seeing in that particular region. That is known as, you can say, observation, right? So the observation, you can see if there is any open injuries, right? If there is any bleeding, or you can say if there is any swelling in that area. So these are the things that you can see, or you can say it is observation. So what we have discussed, the first thing is hears. Hears means it is a subjective information that you are collecting from the participant or the athlete. You are collecting many informations regarding the injury. So that is here. And the second one is feels, right? So that is known as, you can say it's a palpation, right? So you are palpating that area, and you are doing some type of movements, that is passive range of motions, or you are doing some restricted movements, or restricted isometric movements, or you can check some end fields, or you're doing some special test or something, blah blah blah, right? So that comes under the palpation. And sees, right? So that is comes under the observation. And smells, sometimes you can see if there is any so smell, you can say, for example, if there is any different order that comes from that particular region. So it is not very important. So the first three parts, the three criteria are very important under the diagnostic science. So these are the very important things when you face any person, right? So faced with any athletic injuries. So the second thing, I told you about the symptoms, right? So the first part is the diagnostic signs, and the second part is the symptom. So this is very important when you are facing a person, right? When you are facing an athlete with any injury, in sports injuries, it is very, very mandatory to check the some of the important symptoms, right? So you see, the symptom is the information provided by the injured individual. So you may ask the person whether the person has blurred visions, right? Blurred vision means sometimes, due to the lack of blood supply to the brain, the person may, the participant or the athlete may show difficult, have some problems in the vision, right? So it may have altered vision, or reduced vision, right? So that is known as blurred visions. Or sometimes if there is any problem in the vestibular system, they may get some type of sound in the ears, that is known as ringing in the ears, that you can say tinnitus. Or generally the person may have fatigue, right? So that is known as, you can say, weakness, or the dizziness, right? So this same like drowsiness means that maybe due to the lack of blood supply to the brain, which may leads to dizziness or drowsiness. And the participant may say that he may experience some type of vomiting sensation, that is known as nausea. Or sometimes the person may say, the participant may say the headache, right? So pain in the general in the head region, that is headache. Or in the localized region, the person may say the pain in the particular region. Or weakness, you can say there is weakness of the muscles, right? So total body weakness, say the weakness of the lower extremities, or weakness of the upper extremities, or either weakness of one side. So these are the some of the symptoms the player or the participant can say when you are asking such questions, right? So you should be very careful when the participant says such symptoms, you should be very careful, right? So the person is in the serious requirement of medical attention. And inability to move a body part, right? So due to the injuries, right? So due to the sports injuries, the person may not be able to move the body parts. So you should be very careful, right? So when you collected, right? So when you collected these informations, when you collected these diagnostic signs and the symptoms, we should be classify the injury. Either it may be acute injury or the chronic injury. So you are supposed to diagnose on the spot, right? So in the spot, you have to decide whether the injury is the acute or the chronic. So let me explain how to classify the injuries in the acute or the chronic. So I give you the definition, right? So the obtaining information about the signs and symptoms, right? So we have collected the diagnostic signs and we have collected the symptoms, which determine the individual has an acute injury, right? So resulting from a specific event leading to a sudden onset of symptoms. So that is very, very important, right? So you have collected many informations, right? So you have collected many informations about the patient or the player. So if you collected the information, that information is the sudden onset, right? So sudden onset means the injury occurred, the fresh injury, you can say injury to the anterior cruciate ligament, or injury to the lateral collateral ligament, or injury to the quadriceps muscle or the hamstring muscles, or sudden dislocations or fracture. So all these things comes under the sudden onset of symptoms. So all these things which comes under the category of acute injury. But now you come to the type that is known as chronic injury. So what does it mean, right? In cases of this chronic injury. So so let me explain about what is chronic injury, which is characterized by a slow, insidious onset of symptoms, right? So it is a slow and progressive onset of symptoms, right? So the symptoms are persisting for a long period of time, and which produce the final result, final diagnosis, right? So which produce the final painful condition, right? So painful inflammation condition that is known as chronic injury. So for example, I can give you an example, the same example, tennis elbow, right? So you might have had this condition before during your bachelor. The tennis elbow means it is a continuous rupture of the wrist extensors, right? So the extensors of the wrist. So if a player or a badminton player or the tennis player who is doing the wrong techniques during his sports or during his play activities, so which may produce continuous micro rupture, right? So it may be the continuous process for both the 6 months or 3 months or 4 months, right? So you may continuous micro rupture at that region, and finally one stage it produce the problem or the disease, right? It may produce the condition. So this is known as chronic injury. So in sports injuries, right? So you have to understand the difference between the acute injuries and the chronic injuries, right? But when you say about the musculoskeletal injuries, right? So in orthopedic conditions, right? So in orthopedic conditions, the acute and the chronic is depends upon the duration, right? So please understand the difference between the classifications in the sports injuries and the classification in the orthopedic conditions, orthopedic injuries, right? So in orthopedic cases, in patients, we generally classify the stage according to the duration. For example, osteoarthritis, right? So how you classify the osteoarthritis, acute osteoarthritis and chronic osteoarthritis, that depends upon the duration. So for example, if a person or the patient has pain for 7 days, you can say it is acute stage, right? So if the person has pain for less than 7 days, you can say acute osteoarthritis. And same way, the pain is more than, if the pain is existing or persisting for more than 2 months, you used to say it's a chronic osteoarthritis. And if the pain is between the 7 days, or that is from 1 week to 2 months, you can say it is a subacute osteoarthritis. So now you see in this condition, right? So we have classified the acute, subacute, and the chronic according to the duration of the injury. But here in sports injuries, we are classifying the in the sports injury according to the time of onset, right? The onset of injury, right? If it is a sudden onset, we used to say acute injury, and if it is a gradual or slow progressive onset, we can say it is a chronic injury. So I think you got an idea about the difference between the stage of injuries in sports and musculoskeletal conditions, right? So please understand this, right? So next, the before assessing the injury, opposite or non-injured body part should be assessed to determine the relative dysfunction of the injured body part. So this is the common principle, right? So now I'm telling you some of the important principles when you are doing your assessment of the sports injuries, right? So the first thing, for example, the same you just assess a person has anterior cruciate ligament, right? So when a person, when a player is playing football, he got an twist injury at the knee joint. So, for example, there is an injury to the anterior cruciate ligament in the right side, right? So, for example, you just assume a player got an twist injury at the knee joint, that is injury to the anterior cruciate ligament in the right side. So don't test the right side immediately, right? So you have to check the left side, so the normal side. So you see, so you get some idea about the person. You get some idea about the participant, right? What is the normal range? What is the limitations? What is the abilities? All those things you can get the idea. So for that, just for the comparison, you are supposed to do the movement in the normal side. So if the person, if the participant has injured in the right side, you are asked to do the initial assessment in the left side. So you see, the before assessing the injury, the opposite side, that means the non-injured side, should be assessed to determine the relative dysfunction, right? So you can have a comparison, right? So you need a comparison, right? So for example, you should know the normal, right? So when you know the normal, you can when you know the comparison, so you can do you can do the test, or you can do the examinations in the affected side. In some acute injuries, such as fractures and dislocations, assessment of the non-injured body part is not necessary. So, for example, in cases of direct injuries, right, so fractures, there is no need to check very clearly. So, in cases of fractures, in cases of dislocations, there is no need to check because it is a very obvious type of injury. So, generally, in cases of acute injuries, there is no need to go, no need to. But if the person has soft tissue injuries like cruciate ligament injuries, right, anterior cruciate or posterior cruciate ligament injuries, or collateral ligament injuries, or like any muscle injuries, right, or in a tendon injuries, right. So in such cases, you can it is better to do in the opposite side. So this is a very important point that you should keep it in mind when you're doing the sports injuries, right. So let me revise the important points so far. The first one, if a person or a player got an injury, so you are supposed to do supposed to check two things. One is you have to check the diagnostic signs, and you have to check some of the important symptoms, right? So diagnostic signs and symptoms are very important, right? So through these signs and symptoms, through these diagnostic signs and the symptoms, you have to classify the injury into acute or the chronic injuries, right? So acute injuries means it is a sudden onset injuries, and the chronic injuries means it is a long lasting or the slow progressive injuries, right? Then generally when you are doing sports injury assessment, right, so it is better to check the non-injured or the opposite side limb to have a relative dysfunction or to compare with the affected side. So now you come to the part of assessment that is known as methods of assessment. How you are going to assess, all right? So how this assessment, right? How this sports assessment is differ from the musculoskeletal assessment, right? So it is more or less similar, right? So the procedures what you are using in sports assessment are similar, but the arrangement or the order of assessment is different in sports injuries, right? So the methods of assessment in sports injury is known as Hope's assessments, right? So you can say it is a Hope's assessment. Hope's assessment means H, O, P, and S, right? So let me explain about what you mean by Hope's. H means history of the patient, right? So you are getting many informations from the patient, that is subjective information about the patient, that is history. I will explain you in the later slides regarding the history, right? What are the informations that you have to collect from the patient, right? So that is history. And the second one, you have to observe, right? So I will explain. I will tell you what are the things you have to observe. immediately after the injury on the field, right? And the third, palpation, right? So you have to palpate the structures, the affected areas, right? So from that, what are the informations you are going to get in the palpation? And finally, you have to do some important tests that is known as special testing. So be clear, right? But in generally, right? So in musculoskeletal assessment, we are going for the SOAP assessment, right? You might have studied during your bachelor program in musculoskeletal assessment. There is a format that is known as SOAP format. SOAP format means subjective information, objective information, analysis, and planning, right? So SOAP. But in sports injuries, we follow the HOPES format, right? So in SOAP format, you are getting the information, subjective information, and you are doing some test that is objective information, and you are doing some analysis, right? So analysis, and finally P for planning. But in sports injuries, right? So you are doing the HOPES method of assessment, right? So in HOPES method of assessment, the first one is history, right? So you can see the hopes. The first one is you are asking the information about the injuries, right? So that is hopes. So history of the injury, right? So how the injury has happened. So first thing, you are collecting the information, so collecting the chief complaint of the patient. That is known as primary complaint, right? So you think you are a sports physiotherapist, right? So it is a very important field and very interesting field. In Saudi Arabia, now we are exploring with many different type of games. So you might have a very good scope in the field of sports for sports physiotherapy. So, for example, you have been assigned as a sports physiotherapist for any games, for the national or the international or the local games or the university games. Suspect, imagine that player got an injury, any injury, right? So you can say we can fix with the anterior cruciate ligament injury at the knee joint. So, for example, you can see this picture. This player, he is a football player who got an injury in the lateral in the ankle joint, right? So you can see first thing you should get the information about the injury, right? So as a sports physiotherapist, right? So before treating, right? So before treating that particular region, you should diagnose, right? So you should come to the diagnosis of that particular problem, right? So for that you need some important information from the patient, right? So focus on the perception of the current injury, right? So you ask some questions, right? So you ask some questions related to the problem, right? So focus on the perception of the current injury. And what are the questions you have to ask, right? Ask questions to describe the current nature, right? So what is how the person is feeling, how much amount of pain, right? So the intensity of the pain, whether the pain is relating to other joints or faces, right? How much intensity, right? The severity of the pain, the location, and how the pain is arised, that is onset of pain, right? So you can ask such questions to the player. So, for example, you can see, you can ask some open-ended questions like such as, what is the problem, right? So, when the patient fall, right? So, this picture, the person, the player is fall down. And if you are advised, if you are referred to take the treatment in the on-field, right? So that is very important, right? So sports injuries means don't think you are going to treat the person at the department or in the clinic, right? So as a sports physiotherapist, right? So you have a very important role in the field itself, right? So in the ground itself, you have a very important role. You have to assess the person, you have to assess the player in the field itself. That is known as on-field assessment, right? So as a physiotherapist, right? So you have a very important role. That is known as on-field assessment, right? On-field assessment means in the field itself, you are going to assess the player or the participant. So that is very important, right? So don't take too much of time in the evaluation or in the assessment. So because it is very important, right? So if a person or a patient is in the department or in the hospital or at your physiotherapy clinic, you can take sufficient time for the evaluation. But if a player is in the ground or in the field, so it is very necessary. The time is very important for the player, right? So sometimes if there is a small injury, you have to take the treatment, and the person has to participate in the game further. So you as a sports physiotherapist, you have a very important role. So you ask some important questions to the participant. What is the problem? and where is the problem, right? So what has like some important information. So these informations are known as the primary claim complaints. And the second thing, you can ask some how it happens. That is known as mechanism of injuries, right? So how this injury happened, right? Generally, if a player is playing in a proper game, right? If trained persons, right? So trained player or a trained participant, if he follows all the training principles or follow all the guidelines of the particular game, there is less possibility of the injuries, right? So in some cases, in untrained persons, or if the person is not doing the proper warm up or proper training sessions, right? So there may be a possibility of getting the injuries, or if the opponent is not playing properly, there is a chances of injuries, right? So as a physiotherapist, right, it is mandatory to check the mechanism of the injury, right? So this information, right? So this mechanism will give a lot of informations, right? So for example, in anterior cruciate ligament injury, so generally, the mechanism how the anterior cruciate ligament will be injured. So generally, it injured during post extension, right? Post hyperextension and rotational injuries, especially in cases of rotational of the knee, right? So which may produce injury to the anterior cruciate ligament. So, for example, if there is injury to the lateral ligament, right, at the ankle, the forceful inversion, right, forceful inversion of the ankle joint, which produced lateral collateral ligament injury at the ankle region. So, the mechanism of injury will give some information about the diagnosis, right? So, the cause of the stress, right, how it happened, right, whether it may be due to the opponents or due to by yourself, right? The position of the limb and direction of the force, right? You can see in this picture, how the force, a person is kicking the ball, and the meantime the another player is kicking on the lateral aspect of the leg. So which the force is from the lateral aspect, so you can have a direct injury in that particular region. So all the things you have to take consider, in the second picture, the person is trying to kick the ball, and the another player is making interrupting his leg. So there is a possibility, the force is from the posterior aspect, and there is a possibility of fracture in the leg. So changes in running surfaces, sometimes if the surface is not good, the turf is not good, or the shoes, the player who is wearing that shoes are not perfect or not good, or sometimes the equipments, the persons, the participant who is using the equipments, the techniques, the wrong techniques, or the conditions of the player. So all these things matters in coming to the diagnosis or the so so what are the characteristics of the symptoms, right? So you can ask the important characters, right? So the presence of unusual sensations, right? So for example, whether the participant experience pain, or when doing the movement, whether getting some type of snapping sounds or popping sounds, right? So you can ask, right? So for example, in cases of dislocations, right? So for example, in cases of dislocation of the hip joint or in the shoulder joint, when you are doing the movements, right? So when you are doing the active movements, the participant may get some type of snapping sounds, like this is known as the sound produced in the joint. So which may be the cause, which you can diagnose very easily. There is a possibility of subluxation or dislocation of the joint, and how the person is feeling, right? The feeling of the person, right? So these are the very important, right? So, and you have to ask the onset of the symptoms, when it is raised, so to diagnose whether it is acute or the chronic, and the nature, how the person is feeling that pain, right? And where it is exactly, the location of the pain means you can say the pain is in the ankle joint or the knee joint or in the hip joint or in the back region or in the neck region. So that is location. And the severity, you can see the severity means you can say the intensity of the pain, right? So intensity means whether it is acute, or you can say mild, moderate, or severe, right? So this is known as the intensity or the severity, and how long this person has the problem, that is the duration of the symptoms, right? And the disability resulting from the injury, right? So immediately, right? So after any type of such injuries, there is a possibility of some disability, right? So there is possibility of some limitations in the functional activities, right? So that is known as disability, right? So the disability resulting from the injury. So that is immediate limitation. So for example, in case of the same, you take either it may be anterior cruciate ligament injury or ankle injury, that is ligament injury. The person is not able to walk. So that is the first limitation. That is, you can say it is immediate limitations, right? So the person or the participant or the player cannot play the game, or the participant cannot participate in the games, not able to participate in the games. So you can say this is a immediate limitation, right? So this is the immediate limitation of the player, right? Limitations in occupation and activities of daily living, right? So what are the problems the player is facing during his occupation? So occupation means during his activities, right? So either sports activities or during his profession, right? Or doing his activities, the regular activities of daily living, right? So the running, walking, or jumping, or doing his own toileting activities. So in these, you can say it is regular activities of the daily living. So how this injury is limited for that player, right? So that is very important, right? And apart from that, as a physiotherapist, right, you are supposed to ask if the person has any relevant medical histories, right? So that is very important, right? So you are supposed to ask whether the person has any other musculoskeletal injuries, that any past musculoskeletal injuries, right? So what does it mean? The musculoskeletal injuries means sometimes that injuries may leads to the particular problem. So you are supposed to ask about if the person has any other past medical history, right? Past related medical history means you can say if the injury is related to any other medical conditions, like if the person has any musculoskeletal injuries. So, for example, if a person has ankle injury, sometimes if there is any anterior cruciate ligament injury, or if there is any cough strain, right? So, if there is any cough muscles problem, which may leads to because there is more possibilities, right? So, if there is instability in the joint, in such cases, which may prone, right? So what are the factors or the risk factors which produce the particular injury? Or congenital abnormalities, right? So if the player has any congenital problems, like you can say genu valgum or genu varum, right? So this is the inner and the outer deviation of the knee joint, or sometimes the person may have CTV, that congenital talipes equinovarus or valgus, right? These are the congenital problems that which may occurs from the birth. So sometimes there is a chances of CDH, that you can say congenital dislocation of the hip, right? So these are the congenital problems that you can suspect from the birth, right? So which may predispose, right? So these are the predisposing factors for that particular injury, right? So you can say as whether the subject or the participant has any congenital abnormalities, or you can say the family history, right? So sometimes some problems may be a hereditary one or inherent one from the parents or the grandparents, right? So you can ask. So genetic predisposition, right? So sometimes there are some conditions, right? So you can say osteogenesis imperfecta, arthrogryposis, congenital multiplex, right? So these are the some of the conditions which may from the parents or grandparents, right? So you can ask whether your parents or the grandparents have such family history, or sometimes it may be a childhood disease, or you can ask whether the subject is have any allergies to the drugs, or allergy to the environment, or allergic to the any type of. So these are the some of the important informations. So you should collect from the patients, or the person has cardiac problem, or respiratory problem, or vascular problem, or the neurological problems, right? So just you can correlate or any systemic problems, right? So you can correlate the condition with the any systemic problems, right? So these are the very important informations that you have to collect. These are the very very important informations that you have to collect under the history, right? So you understand the first point, hopes under hopes, collecting the history, right? So that is known as history of the injury, or history of the patient, or history of the subject who involved in the particular injury, right? So next we will talk about the observation, right? So this is the right, you can see the observation and the inspection, right? So the first part of the hopes we have completed, that is history, and the second one, the o for observation and the inspections, right? So you are seeing that the seeing, the first one, h, you are hearing, and o you are using, you are seeing, right? You are just observing the person, right? You are just observing the patient, how the person is reacting for that particular injury, right? So the initial observation focus on state of the consciousness. So that is very, very important, right? So the state of consciousness, the first one, right? So immediately after the injury, you just see whether the patient is whether the participant or the player, the participant or the player is conscious or not conscious, right? So that is very important. If the subject is unconscious, right, or if the subject is subconscious, immediately the mode of treatment is totally different. I will explain it in the later slides regarding how to manage such patients, such participants, right? So the stage of the consciousness is very important, whether the subject has conscious or not conscious or subconscious, and accordingly your treatment plan will differ, right? So in that stage, if the participant is unconscious or in the stage of subconscious, nothing to do, immediately ship the patient for the medical emergency, right? So call the medical emergency, ship the participant to the hospital, right? So the nearby hospital, and give the immediate first aid medical treatment, right? So no more role as a physiotherapist in that area, right? So the body language, right? How the person, how the participant is reacting for that injury, particular injury, right? How you can say the severity of the injury, and which may indicate pain, disability, fracture, dislocation, or other conditions, right? So you can see the how much intensity of the pain, how much disability, where the person has a fracture, or if the subject has dislocations or other conditions, right? So this is the first stage, and observe for general posture, right? So how the person is reacting, right? So the posture of the person, right? So the posture can be assessed or evaluated in different positions, right? You can see. So if the person is on the ground, so the lying posture, right? So how the person is lying, right? So in a flexed posture or in an extended posture, or lying in a side lying posture. So this is the posture in the lying. Or if he is in a sitting posture, you can check how the person is sitting, right? So that is, you can say sitting posture. Or if the person is in a standing, you can say check the person or check the participant in a standing posture. Either you can check anteriorly, posteriorly, and from the sideways, right? So the posture should be perfect, right? So you can see the general posture of the participant, right? Willingness and ability to move, how the person is, how the person is reacting to your commands or to your instructions, right? So willingness, and how the participant is able to move. Ease in motion, general overall attitude, right? So you have to check how the person is overall reacting to your commands, reacting to your instructions or your informations, right? So inspect for second thing. So these two things comes under the observation. Observation means observation of the posture, observation of the consciousness, body language, and now you are going for some inspection, right? So this observation and inspection comes under the O. The inspection for any deformity, right? So you can check whether the person has any abnormal movements or abnormal position or abnormal joint movements or abnormal limb movements. So this is known as deformity. Or you can check the swelling, right? So if there is any collection of fluid in the distal extremities, so either in the upper or the lower extremities, you can say the swelling. Or discolorations, right? So discolorations means you can say the changes in the skin color, right? So sometimes there is excessive color, that is redness, or sometimes reduced circulation, that is you can say pallor or bruising, right? This also will give many information about the patient, right? So for example, if the local arteries are ruptured, right? So you can say increased redness in the particular area. Or sometimes if the blood vessel is compressed and there is lack of blood supply, you may get cyanosis, that is bluish color, or reduced blood supply to the particular area. Or you can say ecchymosis. Ecchymosis means the rupture of the blood vessels in the local region. So compared to the opposite side, if possible, right? So I told you always, the assessment, right? Generally, whether observation or inspection or palpation or any type of test, right? Always try to compare with the normal side or the uninjured side, right? So this is very important, which gives lot of information, right? So which give lot of information about the participant. And you check the bony structures, right? So in the palpation, right? So now we are in the third parts of evaluation, right? So first one, we have taken up a good history of the patient, right? So under that, we have taken many informations about the participant. And second, we have done the observation and the inspections, right? So Now the third, the palpation, right? So the palpation is under two categories. One is over the hard tissues and in the soft tissues, right? So in the hard tissues, you can say the bone structures. You have to check if there is any fracture in the particular region. So assume the same anterior cruciate ligament injury or in the lateral collateral ligament injury. You can suspect there may be a possibility of fracture in the femur or fracture in the tibia or fibula, right? So you are supposed to assess through the palpation, right? So just palpate the area. You can see, sorry, or soft tissue structures, right? So in the soft tissues, you can see, you can check the temperature of the skin, or you can check the swelling, or when you palpate, you have a tenderness in the particular region, right? Point tenderness, or sometimes the crepitus. Crepitus means when you make the movement, you have some type of sound, right? So some type of joint sound produced, that is known as crepitus, or abnormal position of the limbs, that is known as a deformity, or muscle spasm, right? When you press the muscles or when you do the movement, you have a severe pain in the muscles, that is known as muscle spasm. It is a protective response of a muscle to any injury. And you can check the sensation of the skin, right? So that is cutaneous sensation, and you have to check the pulse in the particular region. So these are the things, right? So I think you might have done all those things during your bachelor level in the musculoskeletal assessment. So I think I don't want to repeat the same again. So these are the areas that you have to be very clear in the hopes, right? So the first one, you have taken the proper history, and second one is observation and the inspection, and the third one is the palpation. And yeah, along with this, you have to do some important tests, right? So the functional test, so which will give the clear information about the patient, right? So the functional test, you have to ask the patient to do the movement, active movement, right? Whether the participant or the player can do the movements, right? So for example, same, assume the player has injury to the injured anterior cruciate ligament. You just ask the person to do the knee flexion and extension. So these are the two possible movements, and you can ask the person to do the hip movements, right? So flexion, extension, abduction, adduction, and internal and external rotation. You can ask the person to do the ankle movements like dorsiflexion, plantar flexion, inversion, and the eversion, right? So you just ask the person to do the movement. You get some information about the patient, which will give the idea. And if the person is able to do all the active movement properly, so you can say there is no problem in the joint surfaces. And if the person has problem in the active movement, you can perform the movements, that is passive movements, right? So you can feel the movement, this in the end range, that is end field, passive movements and the end field, right? How much the person can able to do by the external force, that is known as passive movement. And still you can give the resistance to the movements, right? So you can see the strength of the muscles, right? So these are the tests that you can perform under the functional test. And in the stress test, you are giving some stress. So for example, stress anterior cruciate, anterior drawer test. So for example, anterior cruciate ligament, right? So in case of injury to the anterior cruciate ligament, so there is a test that is known as anterior drawer test. So this test will be helpful to identify or helpful to diagnose the problem very clearly, right? So for example, that is known as special tests. For example, in cases of injury to the biceps, that is known as bicep tendinitis, the name of the test is known as speed test. So in every joint, right? So in every joint, I think you might have studied the different type of special test in musculoskeletal injuries, right? So in every joint, for every soft tissues, for every muscles, you have a special test to confirm the problem. Next to the special test, we are supposed to do some of the important neurological testing, which you have to test the dermatomes. So dermatomes means the area of the skin which is supplied by a particular spinal nerve, and you have to check the myotomes, right? So the muscles are supplied by some spinal nerves, that is known as myotomes. Check the reflex, that is the superficial and the deep tendon reflexes, and check the peripheral nerves, right? So in the upper limb, check the radial nerve, ulnar, median, musculocutaneous, and the axillary nerve. In the lower limb, you check the femoral nerve, obturator nerve, and the tibial nerve, and the sciatic nerve, right? Common peroneal nerve. So these are the very important nerves that you have to check in the upper and the lower extremities, right? So these are the just superficial testing procedures. And in the sports, right? So especially you ask the subject to do some specific test according to the sports. And in the vital signs, these are the very important vital signs you have to check, right? So you have to check the pulse, radial pulse, right? And you check the person's respiration, whether the person is whether the participant is taking the proper breath, that is around 16 to 18 breath per minute. And check the blood pressure, right? So you just check whether the pressure is in a normal stage. Check the temperature of the participant, and you check the color, skin color. This I have already explained, whether there is more blood at the particular local region, or reduced blood supply, or all those things, right? And you check the reaction of the eyeball, right? So they're checking of the pupils, right? So these are the vital signs. So these are the Hope's treatment, right? So Hope's method of assessment: history, observation and inspection, palpation, and in this, yes, you have a special test, right? So this is the method of assessment. Now, see, you have three stages, right? So, you might, so as a physiotherapist, right, as a sports physiotherapist, especially, I'm telling you, when you are working in a field, when you are working as a sports physiotherapist, specifically, like, I'm not telling about the musculoskeletal physical therapist, but I'm talking about the sports physiotherapist. When you're treating, when you are posted in a game, or when you are posted in some games as a sports physiotherapist, right? You might be facing three situations, right? So you might be facing three different situations, right? So what are the three different situations, right? So the first one is the crisis management, or the second one is on-field management, or third one is the complete management, right? So you have three different principles of approach, right? So you can approach the patient in three levels, right? So I will tell you very clearly, right? So the first one is crisis management, right? So the crisis management means very simple: the participant or the player is unconscious, right? So the participant or the player is unconscious immediately after the injury. So, for example, I can give you an example, right? So there is a football game, a football match is going on, right? A player is hit with the opposite player, right, opponent player, and he fell down and he lost his consciousness, right, immediately after falling. As a physiotherapist, right, as a physiotherapist, you have rushed to that particular area, to the participant, and you observed that participant has lost his consciousness, right? So he has no consciousness. So you have no role in that area, right? So immediately you have to call the physician, right? So sports physician. So it is a team, right? It is a team. So immediately there is a presence of a physician, right? So he may rush the player to the emergency for taking the immediate assessment, right? So immediate treatment. So this treatment is known as DRSABCD principles, right? So that is known as crisis management in the sports injury. And second one, the on-field assessment, right? So the person is good, right? So there is the consciousness is there, and if the person wants to play the game, or the player want to continue the game, so you are in the position to give the immediate assessment in the field itself. So you can see that is known as on-field assessment. You understand? Sorry. So the on-field assessment means you are supposed to, or you are requested to assess that person or the player immediately, and you have to give the immediate treatment, and you have to allow the person to participate in the game. So this is very important. So this is known as on-field assessment. So the principles are known as STOP principles. I will explain you all the type of principles one by one later, right? And the second one, the third type is TOTAPS principle. TOTAPS principle means the complete assessment, right? So the person or the player is conscious, but he is not willing. He is not literally indicated for continue play. You understand, right? So the person or the player is not indicated to play continue, right? So in such case, what you have to do, you have to take the complete assessment, perfect assessment, right? And you can take the treatment in the department, or take the treatment in the sports injury clinic, right? So let me explain one by one. So we'll start with the first, that is the crisis management. How to manage, right? So action plan for injured athletes, right? So if these are the situations, right? So if the person is in danger, right? So control dangers, then assess injured athlete, right? So first point, right? So these are the areas, right? So immediately after any injury, right? If the person lost his consciousness, and if you feel the team the rehabilitation team feels the player is in a danger. So first point, you have to recover the person from the life-threatening situations, right? Control dangers, then assess the injured athlete. And if it is in the life threat, you have to follow these DRABCD procedures. And in cases of field assessment, you can use the STOP principles. And after that, if the person is willing to take the treatment, assessment and treatment, you can go for the TOTAPS for principles and initial management. You can manage the person properly, right? So these are the areas, right? So these are the steps and the actions. So one by one, we will start with the first type, that is the DRSABCD principle. In cases of danger, right? If the person is in danger, you have to give the immediate response, right? So you have to respond how the response, whether the person is reacting to your commands, right? So there is a scale that is known as GCS scale, right? So Glasgow Coma scale, right? So how the person is reacting to your motor response, verbal response, and eye response, and how the person is reacting, and send for help immediately. You have to ask the person, or you have to inform to the sports physician, or for asking for the medical emergency or the medical help, and make the airway, right? So make the clear the airway. And these are the CPR procedures that you are doing under this, right? So A means airway breathing, right? So you have to give mouth to mouth respiration to the participant, and C, you give the circulation, that is CPR, and defibrillation, right? So in the if you have that device, right, you can give the defibrillation. So this is the role of in the stage of DRABCD. So which stage you can say the immediate medical attention stage? So you can say this is red flags. Red flags means the dangerous stage are known as red flags, right? So this is danger, right? So when you can say a person is in a life-threatening stage, or you can say when a person is in a red flag stage, or you can say if the subject has airway obstructions, right? So if the person is not able to breathe properly, or in some cases if the person has respiratory problems, right? There is absence of failure, or in the stage of spinal shock, that is in the severe shock, right? Or if the subject, if the player faced with any chest and abdominal pains, or after injury, if the person has excessive bleeding, uncontrolled bleeding, so the blood volume will be reduced, and it may lead to life-threatening problem, right? And suspected spinal injuries, right? So there is a chances of injury to the vertebra and the spinal cord, or in some cases possibility of injury to the head, which may lead to lack of consciousness, and sometimes in heat illness, right? So for example, player who is doing long term marathon, right? So long term marathon means like 40 kilometers continuous marathon. So there is a possibility of more dehydrations, and which may produce some issues to the participant, right? Fractures involving several ribs, the femur or the pelvis, right? So these are the red flags, right? So red flags means you can say the dangers, right? So these are the danger signs, or you can say red flags or contraindications, right? Apart from that, the associated injuries, like if there is any injuries to the eye, or if there is any injury to the dental, that is removal of teeth, or if there is a minor or simple fractures, right? There is any open cut injuries, that is lacerations, right? So that might require suturing, or injuries in the noticeable, right? So if there is any noticeable injuries, or if there is any lack of sensations in the particular area, or weakness of the muscles, right? So these are the associated injuries, right? So these are not the you cannot say these are the important, right? These are not the dangerous, but we have to take care, right? Immediately you need immediate medical attention in such cases, right? So but I told you some of the important red flag symptoms, right? So if you find any of the red flag symptoms, right, immediately you have to take the player for the medical treatment, right? So these are the associated problems that you should be careful, right? So these are the associated problems that should be careful. So this is known as, you can say, disposition. So emergency injury assessment, right? So emergency, that is known as a dangerous assessment, right? So injuries or conditions that input. So the very important thing, you have to check the vital functions, right? Vital functions of the central nervous system and the cardiorespiratory system, right? So you check the central nervous system, means that is especially the consciousness through the Glasgow Coma scale, and check the cardiorespiratory system. Like you can check the pulse rate, you can check the respiratory rate, you can check the blood pressure of the patient, right? So if there is any alterations, right, so immediately you should rush the player for the medical attention. The same thing I'm telling you, right? Again, right? So and the same. And if you find any of the red flags, I have indicated some of the red flags in the previous slide. So if you observed or if you noticed any of that red flags, immediately you rush the patient for medical plan, right? Uh, Medical treatment. And this is the second stage, the second principle, that is stop principles. So the first principle, I think, got an idea. DRABCD, dangerous, response, right? Airway, breathing, circulation, and defibrillation, right? So the DRABCD principles, if the player is in emergency situation. And this stop principles, the stop principle is for the on-field assessment, on-field treatment. Right. So what do you mean by stop? STOP. Yes means stop the athlete from moving or further participating. Stop the game if necessary. Right. So immediately stop the game. Right. So if the player is playing and he got an injury, either for example, just we are assuming anterior cruciate ligament injury. Right. So immediately you should ask the person to stop the game. Right. And talk to the injured athlete. Right. So you can talk. T for talk. Right. S for stop. T for talk. So what you have to talk, you get the information or information about the patient, what happened, how did it happen, what did you feel, why does it hurt, right? So all this information you can collect, right? Whatever information if you want to collect from the player, you can get it, right? So which may give the information, which may give the proper diagnosis, right? So you can get as much information from the participant or the player. And observe, right? Observe while talking to the athletes, right? So you can do the observation and P finally the prevent the further injuries, right? So you can find further injuries. So you come to the diagnosis and you can prevent the further injuries. So I told you before, right? So the stop principles are applied for the on-field assessment, right? So in the field, right? So in the ground, you are making these assessments, right? So this is why it is known as on-field assessment, right? So it is used to guide a fast on-field assessment, right? The stop is conducted after life-threatening problems have been managed using the DRS to BCD principles, right? So once the person or the player is conscious, you can go for the second stage, that is stop principles, right? Depending on the outcome of the stop assessment, the sport trainer should be able to decide if the athletes, right? So after doing this assessment, right, after doing this stop assessment, as a physiotherapist, right, can remain on the field, continue to play with or without further treatment, right? So, if the injury is very small, so for example, I can give you an example. So, for example, a player got a hamstring strain, right? You just understand, a player got a hamstring strain, right? So, a football player during his game, due to the abnormal position, he got a strain in the hamstring. So, this is not a major issue, right? So, this is not a major problem, right? He is a very, for example, he is a very important player in that game. So you can make the assessment and you can give the treatment for 2 to 3 minutes, right? So just apply some coolant spray, vapor coolant spray, or immediate treatment. Within 2 to 3 minutes, the player will be all right, right? So you can decide whether the participant can continue the game. So you can see can remain on the field or he can continue to play with or without further treatment, right? So sometimes if you need 1 or 2 minutes of rest or 1 or 2 minutes of treatment, after treatment he can continue the activities and should remain on the field of play for further treatment due to the risk of further harm if they are moved, right? So you can decide, you can take the person to the rehab clinic or you can take the person to the rehabilitation center for the further treatment. Can be safely moved off the field for more detailed assessment using the TOTAPS principle, right? So if you feel, right, so for example, not a hamstring strain. So for example, if the person met with fracture or dislocations, right? So for example, dislocation or fracture at the limb. So he is not eligible to play further in the game. So you should ask the person or the player to go for further treatment, right? So he will be moved towards for the further assessment. That is known as TOTAPS principles, right? So now you understand. The first one is DRABCD principle, right? So if the person is unconscious, follow with the DRABCD principle, and if the person is conscious and if the injury is minor, you can go for the stop principle and you can give treatment. And further, if the injury is major and the person is conscious, you can go for this TOTAPS principle, right? So what does it mean? The TOTAPS principle. So talk to the injured athlete. Same. You are asking, you are interacting with the subject, and you are getting the information about the patient, and you are observing the area, right? So observe, for example, person met with an fracture in the shaft of femur, right? So you get information as much as possible. Uh, and you find observe the area and touch the injured area. That means you are palpating the area, right? So the temperature, the swelling, pains, the spasm, right? So all those things you are collecting, that is palpation. And you are asking the person to do the movement, active and the passive movements, and you are doing some of the important special tests. So these are TOTAPS principles, right? So talking, observing, touching, active and the passive movements, and the special movements, right? So that's it about the three different type of assessment, right? So DRBCD assessment, STOP assessment, and the TOTAPS assessment, right? So I think this is sufficient for you. And what are the important points, right? So the additional points that you should be very careful when you are going for sports injury assessment and the treatment. So when a person or athlete met with any injury, so as a physical therapist, right, you are supposed to remove the protective equipments in a very safe manner, right? So you have to remove the mask. Sometimes in cases of rugby or in some games like cricket, they used to wear the helmet that is known as face mask, right? So you are supposed to remove that mask very in a very professional manner, right? So sometimes it may injure, right? So the removal also a very important role, right? So sometimes if you are not removed properly, it may exacerbate the problem or exacerbate the condition. So you should be very careful, right? And same way, the same will be applied for all type of protective equipments like removal of the mouth guard, or removal of the helmets, or removal of the pad in the shoulder region, thigh region, knee region, or removal of the shin guards or any supportive sleeves. So as a physical therapist, you should know how to that is known as wearing, right? So don and doff, right? So that is known as don. Don means wearing of the protective equipments, and doff means removal, right? So as a physical therapist working in the field or working in the ground, you should know how to wear, how to don, and how to doff these protective equipments, because the removal of these such protective equipments also plays some issues, right? Some problems to the patients, right? So you should be very careful when you are removing such protective equipments, right? So next one is moving the injured participant. How so this and all, you have a very good team, right? So as a physiotherapist, right? So not only you will be there, right? So along with you, you have a good medical team, right? Medical good rehabilitation team will be supporting you for the moving the injured participant for the treatment. So ambulance assistance, right? So how to convey the patient, that is known as how to roll the person, right? How to transfer the person, that is known as manual conveyance, and transport by spine board, how to transfer from the ground to the board or pool extrication, right? So sometimes in some types of water games, right? So some type of water games, the person may get injured. So as a physical therapist, you have to you should know how to take the person from the water. So that is known as pool extrication. So right, so I'll give you some of the pictures which give the idea about the transport by the spine, right? So you can see transport by the spine board. You can see the whole team is there. The person has got an injury, right? So the board is known as log roll method. So you have to follow this method, right? So make the person in a sideline. So in the step one, keep the spine board parallel to the person, right? So the step two, right? So all the persons should make the person in a sideline position, right? Again, you third step, you keep the spine board towards the person and stabilize the person. So that is very important, right? So all the body parts should be stabilized with the proper straps. That is very important in the step 4. So there should not be any movement, right? So sometimes these movements may produce or exacerbate the problems. So next to that, school extrications, right? How to escape, how to save, how to escape a person, how to serve a person who got an injury in the water, right? So this is known as school extrications, right? So these are some of the important steps that you have to follow to keep a person, affected persons or injured persons from the water games. So next to these two things, we are supposed to do some of the important diagnostic testing, right? So along with the assessment, right? So what are, right? So you did many different type of assessments, right? So it comes to some conclusions, right? It comes to conclusion. So, but as a physiotherapist, right? So you have to confirm the diagnosis with the help of some laboratory investigation. So that is not only laboratory, you need some diagnostic testings, right? So for that you can you can refer the person for some of the important testing procedures like laboratory testings like urine test or blood test or stool test or whatever it may be, right? So you can go for some any genetic test and also so on, right? So radiography, that is known as X-ray, or you can ask a person for doing CT scan or MRI. So especially for the brain and the spinal cord injuries, right? So or soft tissue injuries, you can go for the MRI scan or radionuclide. So for the bone or ultrasound for the internal organs or EMG, that is electromyography for the muscle functions, right? So after doing your assessment, right? After doing your all type of assessment, right? Either it may be a DRBCD assessment, or it may be a stop assessment, or it may be a TOPS, TOTAPS assessment, or it may be a TOPS assessment to confirm your diagnosis, right? So to confirm the diagnosis, you need some diagnostic confirmations, right? So which will give or which will confirm your diagnosis, right? So you ask the person in the later time, right? You can ask the person to do the any of these investigative procedures to confirm your diagnosis, right? So you will be diagnosed. So the assessment part of the sports injured person is over, right? So once you diagnosed, the treatment is different, right? So once you diagnosed, right, whether it is acute injury or chronic injury, or whether the injury is a soft tissue injury or a hard tissue injury, or in a soft tissue injury, whether the injury is in the muscle or muscle or ligament or tendon or capsule or muscle, anywhere, right? So once you are very clear in the diagnosis, the treatment is different, right? So you can go for the treatments. So in the forthcoming lectures, I will explain you about the different type of injuries, right? So sports injuries in the lower limb or in the upper limb and in the spine. So that's all about the assessment, sports injury assessment, right? So in the first lecture, we have discussed about the introduction about the sports injuries. So I request everyone to go for the lectures, lecture 1 and the lecture 2. And if you find any difficulties or if you find any issues in the lectures, right, so we can have a lecture during lecture 3. So I think you all are clear. If you have any doubt, we can have a discussion. Yes.